Eye therapy is one of the most common nursing skills and also one of the easiest to underestimate. Because it is performed so often, it can start to feel routine. But when IV therapy is treated as routine, errors happen quickly and patient safety is put at risk. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. Many students think IV therapy is mainly about inserting a cannula and hanging fluids. In reality, it is about maintaining controlled access to the bloodstream. Once that access exists, everything infused has immediate potential to help or harm the patient. That is why IV therapy is as much about judgment as it is about skill. Think of an IV line like a direct pipeline into the body. If something goes wrong in that pipeline, the effects appear quickly. In the same way that a leak in a water line can damage a building before it is noticed, IV complications can escalate rapidly if they are not recognized early. At the bedside, IV therapy requires continuous assessment. Nurses monitor the insertion site for signs of infiltration, phlebitis, or infection. They assess the patient for fluid overload, allergic reactions, or changes in vital signs. These observations matter more than the technical act of starting the IV itself. Understanding IV fluids also requires basic reasoning. Is the patient dehydrated or overloaded? Are electrolytes affected? Is the medication vesicant or irritating to veins? These questions guide fluid choice, infusion rate, and monitoring priorities. IV therapy is never one size fits all. Across healthcare settings, IV therapy supports critical treatments. Fluids stabilize blood pressure. Medications manage pain, infection, and cardiac conditions. Nutrition and blood products sustain life when oral intake is not possible. Nurses serve as the final safety check before these therapies enter circulation. The nclex tests IV therapy by focusing on safety and recognition of complications. Questions often ask which finding requires immediate action or when an infusion should be stopped. The exam is assessing whether you can identify danger early and protect the patient. In real nursing practice, safe IV therapy follows a consistent mindset. Nurses verify orders, assess the patient, choose appropriate access, monitor continuously, and respond promptly to changes. Documentation and communication with the healthcare team are essential parts of this process. IV therapy also reflects a broader nursing responsibility. Because nurses are closest to the patient, they are usually the first to notice when something is wrong. Acting early can prevent tissue damage, infection, or systemic complications. Now that you understand IV therapy as a dynamic process rather than a simple task, the next step is applying this knowledge through real clinical scenarios. Case-based learning will show how early assessment and timely intervention make the difference. And that's exactly where we'll go next here at the Learning Studio.